If you've just joined us, you're watching the News at 10 broadcasting live on Channels Television, Lagos. Now, a reminder of our main stories. Borno State Governor Kashim Shettima vents his frustration with the military over Boko Haram attacks. It says Nigeria is in a state of war. The military replies Governor Shettima maintains it's winning the battle against insurgents in the northeast. Governor Chibike Amechi accuses presidency of stifling developments in Rivers State, asks Obasanjo to intervene, but former president says, do it yourself. And 4 people killed and over 50 trapped after ceiling collapses in South Korean auditorium. Found on our website ChannelsTV.com and on YouTube.com/channelsweb. To get us on the move, visit m.channelstv.com to view us live on your mobile device. You can also download the Channels TV app for Android, iOS and Windows phones from the respective stores. Well, you can now interact with the Channels Eyewitness feature on our Android and Windows 8 platforms. If you have pictures or videos to share with us, tap on the application on your device, swipe to reveal the Eyewitness menu and follow the instructions to share your report, pictures and videos. Now, talking about Eyewitness, this is one of the pictures sent in by some of our eye reporters from Ipaja area of Lagos. Is this picture showing the river that runs between Ikaja and Command area gradually being blocked by waste. The Eyewitness is asking the State Minister of Environment to act ahead of the rains, as this waste dumping could lead to the flooding of the nearby Okeshagun community. We want to thank you for keeping us abreast of happenings via our Eyewitness platform. The lack of access to power by Nigerians will soon be confined to history as measures are being put in place to ensure that no community in the country remains in darkness. This assurance is coming from the Minister of Power, Professor Chinedu Nebo, who says the federal government is committed to providing power to all Nigerian communities, both rural and urban. Addressing participants at a one-day conference organized by the Nigerian Association for Energy Economics, the minister urged members of the association to assist the government in improving power supply in the country.
So many of the critical issues with regard to providing power to our people have been addressed or are being addressed. But the critical issue of access is something that brutally looks at us in the face and tells us not much is being done. So we hope that there will be a good level of symbiosis between the Ministry of Power and the MAEE so that we can have the synergy that we need in order to make sure that no community and eventually no child in Nigeria is left in darkness. We need to do that.
Well, earlier today, former President Olusegun Obasanjo commissioned some projects in Rivers State, and he was being hosted by to a gala night. Speaking at the event, the governor, Mr. Chibike Amechi, asked the former president to tell the federal government to stop stifling development in Rivers State. In response to that, Chief Obasanjo told the governor to do it by himself. Well, the Executive Director of the National Primary Healthcare Development Agency, Dr. Ado Mohammed, has denied reports that there is a shortage of vaccines in the country. At a meeting with the agency's technical partners from the World Health Organization and UNICEF, Dr. Ado said Nigeria has a stock of vaccines that can last until the third quarter of this year. The agency also announced plans to procure more vaccines before the current stock is exhausted.
Media reports that Nigeria's fight against polio may be in jeopardy owing to a shortage of vaccines has been debunked by the Executive Director of the National Primary Health Development Agency, Dr. Ado Mohammed. Dr. Mohammed denied report of a shortage of vaccines, saying Nigeria has not recorded a single case of polio in the last 9 weeks.
We have adequate vaccine that will take us up to third quarter of 2014. And you remember that a few months ago, precisely in November 2013, we launched the National Immunization Strategic Plan of Action. And that is for us to consolidate on the gains that we've made on the immunization.
A top official of the United Nations Children Emergency Fund corroborated the claims of the agency, just as a counterpart from the World Health Organization assured the agency of continued technical support.
We want to reaffirm in the Nigerian people that we have enough vaccines in the country, that at the end of January, the government transferred to UNICEF $8.8 million to procure vaccines that will cover these next 2 quarters of the year. So we are working together with the government to ensure that we have the funding available to cover the rest of the year, and we want to appreciate the government because they are concerned on the well-being of the children, and they want to make sure that vaccines are available in the country that covers not only December this year, but the first quarter of 2015. So this is something that the government is preparing a plan to understand what those financing requirements will take.
The availability of vaccines is critical, and this is why the government has made all efforts, joint with partners, to ensure that the vaccines are available. Available not only at the federal level, but available even at the most peripheral area, in order to ensure that the target children are vaccinated in due time.
With the assurance of adequate vaccines and the concerted efforts of the National Primary Healthcare Development Agency in the fight against polio transmission in Nigeria, achieving zero prevalence of polio appears to be in sight.
Well, as part of efforts to boost women and children's health in Delta State, a maternal and child care hospital has been established in the Central Hospital, Warri. At the commissioning of the facility, the state governor, Dr. Emmanuel Udwaha, says the new center is part of the free maternal and under-5 health program of his government. Our correspondent, Yomi Otaigbe, was there and now reports.
It's all about the health of the mother and child. Everyone in and around Warri, including the Delta State Governor and the Olu of Warri, converged on the Central Hospital to witness the birth of a new maternal and child care center.
There are 65 general and central hospitals here in Delta State and over 400 primary health centers where maternal and child health services are rendered.
But this is the first hospital dedicated to mother and child.
This modern health facility is equipped with state-of-the-art medical equipment and is staffed with commensurate quality of manpower that can provide specialty level maternal and child health care. It has the capacity to accommodate 400 patients at any point in time. Once we are through with this commissioning and this center becomes operational, which is already doing, we'll be stepping into a new level in the annals of maternal and child care in the rich history of healthcare delivery in Delta State. With this new center, we'll be better positioned to achieve the SDGs as related to maternal and child care by the year 2015.
The Delta State Commissioner for Health and the Chief Medical Director of the Central Hospital, Warri, speak on the need to expand maternal and child health service delivery in the hospital.
In our old facility, we have an antenatal hall that could only seat about 80 women comfortably. With 250 antenatal women daily, the result was that there was overflow into the walkways. And the MCC has 2 beautiful holding areas, as you can see on both your left and right.
that has the capacity to contain our daily antenatal attendance.
This center was built and designed to provide tertiary level care and to handle very difficult obstetric and pediatric cases. It is planned to be a referral center and has the equipment and staff to function effectively at the tertiary level.
The Delta State Ambulance Services was also launched in the Central Hospital Warri as part of life-saving measures. Yomi Otaibi, reporting for Channels Television News.
Well, the News at 10 returns. Lagos State Governor signs the no smoking bill. Join us again.